Okay, let's dive into something that can look really alarming when you first see it,
Hmm.
but often the reality is actually much more hopeful. Today, we're taking a close look at Bell's palsy.
Right. And we're using a set of excerpts from a text called Understanding and Managing Bell's Palsy as our guide today.
Yeah, it lays things out pretty clearly.
It does, gives us the core info we need.
Absolutely. So our mission here really is to pull out the most important insights from this material
Right.
so you can quickly get what Bell's palsy is, what's happening under the surface, how it might affect someone, and importantly, how it's usually managed.
It's kind of your quick guide to the essentials.
Exactly, a shortcut to getting a handle on it.
Okay, so first off, this condition,
Yeah,
it's sometimes called idiopathic facial paralysis.
idiopathic,
Yeah.
right, meaning we don't always nail down the exact cause.
Precisely. That's part of it. But the text tells us what is happening physically. It's caused by inflammation of a very specific nerve.
Okay, which nerve?
It's unilateral inflammation, meaning one-sided of the seventh cranial nerve.
The facial nerve, the one that controls, well, your facial muscles.
Exactly that one.
So swelling on that nerve just on one side of the face,
Yeah.
the result of that inflammation is?
That's what leads directly to the main sign.
Yeah.
Weakness or sometimes complete paralysis of the facial muscles. Again, usually just on that one side.
Got it. So that visible drooping people associate with it,
Mm-hmm.
that comes straight from the nerve issue. Does the text say who tends to get this most often?
Yeah, it mentions it's most common in people between 15 and 45 years old.
Interesting age range. Okay, back to that idiopathic part. If the exact trigger isn't always clear, what kind of theories does the material mention?
Well, it touches on a few possibilities. Leading theories include things like dormant viral infections waking up.
Like what kind of viruses?
Things like herpes simplex or herpes zoster, the chickenpox shingles virus. Things many people carry anyway.
Right. Lying dormant until something triggers them.
Exactly. Or potentially autoimmune syndromes could be involved. But again, no single confirmed cause for every case.
So something kicks off this inflammation targeting that nerve, and the source talks about how the swelling causes the paralysis, right? This pressure paralysis idea.
It does, yeah. It's quite mechanical, actually. Think about the facial nerve running through a pretty narrow, bony tunnel in the skull.
Okay.
If that nerve gets inflamed and swells up, it gets compressed inside that tight space.
So the swelling itself is literally squeezing the nerve.
Yes. And that compression can be enough to, well, potentially damage the nerve fibers directly, or it might reduce the blood supply getting to the nerve.
Ah, cutting off its lifeline, basically.
Right. And if the blood supply is significantly reduced, you can get what the text calls ischemic necrosis, which is really just tissue damage from lack of blood flow.
Wow. So that physical pressure is really key. Okay, so once that happens, what's the experience like for the person? What are the symptoms?
Well, the most obvious one visually is the facial distortion we mentioned. One side just isn't moving properly, and the text says the severity can really range.
From just a bit weak to totally paralyzed on that side.
Exactly. And beyond just how it looks, there are other things someone might notice.
Like what?
The material lists things like the mouth drooping on one side, which can then lead to drooling, unfortunately.
Okay.
Also, sometimes excessive tearing lacrimation, it's called, which seems a bit weird, right?
Yeah, why more tears?
It's because the nerve disruption affects tear control and how tears drain from the eye, so it kind of overflows.
Huh. That's surprising. Is it painful at all?
It can be, yes. The text mentions patients might feel pain, sometimes in the face, maybe behind the ear, or even in the eye on the affected side, so it's not just about movement.
And functionally, day-to-day things must get tricky.
Oh, absolutely. And muscle weakness or paralysis, it can cause real problems, like difficulty speaking clearly because you need those muscles to form words.
Right.
And trouble eating properly on that side because you can't control your cheek or lip very well.
Wow, all from that one inflamed nerve. It sounds, well, pretty distressing, especially seeing your face droop like that.
It definitely can be. But this is where the material offers some really important reassurance.
Okay, good. What's the key message here?
This is probably the most critical takeaway from this text regarding Bell's palsy. The vast majority of patients recover completely.
That's huge, because seeing facial paralysis, your mind can jump to really serious stuff.
Exactly. And the text specifically points out something crucial to communicate. Patients need to be firmly reassured that this is not a stroke.
That's often the immediate fear, isn't it?
It is. The appearance can mimic some stroke symptoms, but the underlying cause is different, and with Bell's palsy, it usually resolves.
Okay, so not a stroke,
Yeah.
and most people get fully better. What's the usual timeline for that recovery? Does it take long?
The source suggests that spontaneous recovery, meaning it gets better on its own, usually happens within about 3 to 5 weeks for most patients.
3 to 5 weeks. That's actually, well, relatively quick for most people. That's good news.
It is.
And once someone's had it, are they likely to get it again?
According to this text, Bell's palsy rarely recurs. So for most individuals, it's a temporary one-off event.
That's a really hopeful picture overall then, based on this material. So knowing recovery is likely, what's the medical approach? What are the goals of treatment?
The objectives described here are pretty focused. Mainly, it's about maintaining the tone of the facial muscles while the nerve is healing
Okay.
and trying to prevent or at least minimize denervation that's permanent damage to the nerve fibers.
Right. So how do they try to prevent that damage and help the nerve heal faster?
The main medical treatment highlighted is corticosteroid therapy. Medications like prednisone are mentioned.
Steroids. Okay. What's their role here?
Their main job is to tackle that inflammation and swelling the edema on the nerve.
Get the swelling down.
Exactly. By reducing the swelling, it helps relieve that pressure we talked about inside the bony canal. It reduces the vascular compression, lets blood flow better to the nerve again.
Getting that blood supply back seems critical. Is timing important for the steroids?
Absolutely crucial, according to the source. Starting them early, ideally within 72 hours of symptoms, starting is described as highly effective.
Within 3 days.
Yeah.
And highly effective means what exactly? What benefits does starting early bring?
Well, it can significantly lessen how severe the paralysis gets. It helps relieve the pain that can come with it. And importantly, it seems to help prevent or minimize that permanent nerve damage, the denervation.
So early steroids are really key. What about just managing the pain itself?
For that, the text mentions using simple analgesic agents, regular pain relievers to control any facial pain.
Makes sense. Are there any other treatments mentioned?
It does note that sometimes electrical stimulation might be applied to the face.
Electrical stimulation. Wow.
The idea there is to try and prevent the facial muscles from weakening too much, from atrophying, while they aren't getting proper signals from the nerve, kind of keeping them active.
Keeping them ready for when the nerve recovers.
Yeah.
Okay. What about surgery? People sometimes ask about that.
Yeah, the material addresses surgical decompression, trying to relieve pressure on the nerve surgically. But it calls this controversial.
Controversial now.
It explicitly states there's minimal evidence this surgery is actually helpful for Bell's palsy, so the standard approach discussed here is definitely non-surgical.
Okay, minimal evidence for surgery. Good to know where this text stands. That brings us to the really practical day-to-day care stuff, often called nursing management. What's the #1 priority while the paralysis is active?
This is super important, and the text really stresses it. Protecting the eye from injury.
The eye. Why is the eye suddenly at risk?
Because when the facial nerve isn't working, the eyelid on that side often doesn't close all the way. And the blink reflex, your natural way of clearing and protecting the eye, is either diminished or just gone.
So the eye surface is just exposed.
Exactly. It's vulnerable to drying out, dust, little particles getting in, all things that can lead to irritation or even serious corneal ulcers. Plus, that drooping lower lid messes up normal tear drainage.
Oh, wow. Okay, that makes total sense. The eye's natural protection is offline. So what specific things does the material recommend doing to protect it?
There are several practical steps listed. At night, it suggests covering the eye with some kind of protective shield.
Like a patch.
Well, it mentions a shield and actually adds a caution about patches, that if the eyelid isn't fully closed underneath, the patch itself could potentially rub against the cornea.
Ooh, good point. What else at night?
It also suggests manually closing the paralyzed eyelid before going to sleep. Just gently closing it yourself.
Simple, but necessary. What about during the daytime?
Keeping the eye moist is key, so using moisturizing eye drops frequently during the day. And then maybe a thicker eye ointment at bedtime for longer-lasting lubrication.
Drops by day, ointment by night. Got it. Anything else for daytime?
Yeah, wearing wraparound sunglasses or even goggles when outside. This helps reduce evaporation from the eye surface, keeping it from drying out so fast.
These all sound like really vital daily routines to prevent serious eye problems.
They really are crucial.
Now, once things start getting better, nerve sensitivity returns a bit. Does the text mention helping the muscles themselves?
Yes. Once the face isn't overly sensitive to touch, it suggests gentle massage. Specifically, a gentle upward motion done several times a day to help maintain muscle tone.
Gentle upward massage.
Okay.
Any exercises?
Absolutely. Facial exercises are recommended. Things like trying to wrinkle your forehead, puffing out your cheeks, whistling.
Things you might take for granted normally.
Right. And it suggests doing these exercises while looking in a mirror. That helps the person see any flickers of movement and helps prevent the muscles from atrophy while function returns.
Using a mirror makes a lot of sense. Good
Yeah.
feedback. And finally, there's one environmental thing mentioned.
Yes, just a practical tip. Avoid exposing the affected side of the face to cold air and drafts.
Okay. Another simple care point. You know, it's pretty amazing how quickly you can get a solid understanding of something like Bell's palsy just by focusing on the key takeaways from a source like this.
It really is.
We've gone through the definition, that underlying nerve inflammation, the pressure aspect,
The symptoms, both visible and functional.
the really vital reassurance about the prognosis, that it's not a stroke.
Right, the importance of early treatment like steroids.
And then all those critical practical steps for care, especially protecting that vulnerable eye.
Yeah, we've really distilled the core information from the seventh cranial nerve issues, the impact of that inflammation, right through to the high chance of recovery and how to manage it day to day.
We basically took that text and pulled out the must-know points just for you.
Definitely. And, you know, as we wrap up this deep dive, it makes you think, it's truly remarkable, isn't it, how our nervous system works?
How so?
Well, how something relatively localized, like inflammation on one nerve, can create such a dramatic, visible disruption. You see it right on someone's face.
Yeah, it's quite striking.
But then the body often has this incredible inherent ability to heal, for spontaneous recovery to happen, restoring function that seemed completely lost. It really highlights the complexity, but also the resilience that's just built into our biology. Makes you think about that hidden capacity for healing we all carry around.